a year, which barely meets tuition requirements. So we want to make sure that we increase those requirements. We want to increase the local matching requirement for grants from $200,000 to $400,000 exemption. And we want to take ANAPISIs, which are Asian American Pacific Islander serving institutions, and make them part of what is commonly called guaranteed funding. Put it in a plan which will make sure that they are treated similar to historically Black colleges and universities and Hispanic serving institutions. This is legislation which I was the first one to introduce this legislation, and of course it needs more work, and we want to make sure that our institutions have access to this. Both the Guam Community College and the University of Guam have had the opportunity to get this grant, but the grant needs to be upgraded so that we can provide more services to our students. In healthcare, now healthcare has really changed as a result of this coronavirus pandemic. We are in the middle of not just making sure that we want to have accessible healthcare to all of our people, but we want to make sure that it's accessible from both the private sector and as well as the government sector. And so we need to apply the Affordable Care Act to Guam in a way that makes sense to the island. There's a few points there which don't quite match up, and I know that with consistent effort with people in the healthcare industry and in the healthcare business, we can make effort in that. We also need to, the coronavirus pandemic has indicated that we need to have a stronger federal partnership and maybe shoot for one of those 20 trauma centers which are sponsored by the Department of Defense to work with us so that we can have a trauma center for future pandemics, that we make sure that we're ready, that the pandemic facilities are already intact, that the planning is already intact, that we don't wait until the situation gets so desperate. We also have indicated that even though we have many healthcare professionals, a lot of them need to be cross-trained. And we need more healthcare professionals in other kinds of fields, in ancillary fields. So we're going to try to make money available for training for those opportunities for both the ancillary services and cross-training for professionals so that they can do different things and become accustomed to different specializations. And we want to support, of course, the facilities on the island, including the possibility of building a new hospital and community health centers, increase the opportunity to do telemedicine, telemetry medicine, and in terms of actual policy, we want to eliminate the Medicaid cap. Currently, we have an indigent care program, which basically has gutted out because of the fact that we have these Medicaid caps. And so we want to make every effort to eliminate that Medicaid cap so that people can be, the government funding for some of the indigent health care actually goes to people who are really falling through the cracks and not making up the shortfalls that we experience in Medicaid funding. So those ideas are the ones that we think are doable. Those ideas are not so difficult. Well, they aren't going to be difficult. I don't want to underplay them. They're going to be difficult, but they're very doable. We've gone through this after careful consideration. We've consulted people in the healthcare industry. Of course, we've consulted our educational partners. And the one key element of both our educational platform and our healthcare platform is that you can expect constant communication with the delegate's office. You can expect that we're going to have regular communication and consultation on key policy items, and that when individuals and leaders go to Washington, D.C., they're going to be received well, and that we're going to facilitate their visits so that more benefits can come to the island. So that concludes my presentation, and I'm ready for questions, and I'll answer any questions. And of course, I believe that Therese has already given you the actual platform. Okay, so I'm ready to answer any questions.
Okay, the floor is open. Anyone have any questions for the Congressman?
Hi.
Hi, Lonnie.
Oh, good afternoon.
Good afternoon.
Good afternoon.
You spoke about the Affordable Care Act and bringing it to Guam. Can you expand on that and talk about what it would take to do that and how you think it might benefit the community?
Well, of course, one of the things that's difficult for the application of the Affordable Care Act is that making Medicaid available to everybody. And of course, we have a cap on Medicaid. So if we're able to kind of fix that Medicaid part, then it actually makes the partnerships more available. I think the other thing is that there'll be some local institutional involvement in setting up the platforms for which people can access healthcare. We're a small community, and so there's going to be some fits and starts there. Although we have a very active health insurance community, so we'll just have to kind of work that out. But I think the biggest stumbling block for us is these Medicaid partnerships, because we don't have full funding for Medicaid. So we're not able to provide the same level of service through the Affordable Care Act that, let's say, a state like Kentucky or someone else where there's a lot of people on Medicaid and they are fully funded. So in our case, there could be more people eligible for Medicaid, but we're not fully funded. And so it really is sort of a sieve in terms of the resources that are applied to healthcare. I think that's the main problem.
Thank you, Lonnie. Luella, you're up next.
Hi, Dr. Underwood.
Yes,
Hi. You mentioned construction of a new hospital as one of your priorities for healthcare, and any proposal or ideas on how to fund the project?
Well, of course, we'll have to explore that. There's a number of options that are available to us. Some of them will involve loan packages. Some of them will involve rural development. The way that gets off the ground is to have active consideration of federal resources. I don't think we've had that opportunity. And I think that it's like trying to see the entirety of it. So it's not just, even though the hospital is the focus of it, there has to be other opportunities associated with it, including senior care and including the possibility of a medical school. Because when you see those things kind of working together, and you also, which I'll announce next week, a veterans hospital or veterans facilities, you can see that you're really expanding the possibility of healthcare services on the island. And that's what we're trying to do. So it's not just, it's not as easy as saying, well, I'm going to go there and get a $50 million appropriation for a hospital. It's really trying to figure out what are the loan packages. And there are a variety of sources that we can consult on that.
Thank you. Can I do a follow-up? Just one last.
Sure. Go ahead.
So also, do you have any plans for developing our healthcare workforce to fulfill the current labor and service gap on Guam? And what do you think of outsourcing labor from outside Guam?
Well, we can outsource labor for emergency needs, and of course needs that are more immediate. But the idea of cross training and providing training opportunities for that is that health professionals are, just like many professionals, they're involved certain lines of their profession. If we provide more cross-training opportunities, they'll have more opportunities to provide services in different specializations, and they'll be able to meet the needs of the community more. In addition to that, the COVID-19 pandemic crisis has indicates, depending on how you estimate it, there's application of models needed for healthcare workers, not necessarily just doctors and nurses, just people who work generally in healthcare. Some estimate that there's probably a shortage of between 3,000 to 4,000 of these individuals in Guam. So that presents training opportunities for ancillary services and for the kinds of services, even as we go through, for example, contact tracing, even as we try to figure out what kind of healthcare services are we going to provide in the future, given the circumstances we've confronted with the pandemic, and then how are we going to meet those? So obviously, a lot of retraining needs to occur, and there's going to be opportunities for those individuals who are currently unemployed to try to go into a different field altogether. And some of these involve very short-term training, some involve long-term training, and I'm envisioning that we're going to see a revival of short training institutes and schools on the island, in addition to the kind of training that occurs at the Guam Community College and the University of Guam, that will try to meet these needs, and we want to facilitate that effort.
Thank you, Dr. Underwood. I don't have any further questions.
Thank you.
Thank you, Luella. CJ, you're up next.
Hey, half a day.
Half a day, CJ.
I got a question about I like that you brought up the Wi-Fi as a utility, and it's pretty sad that some teachers are only getting 30% of their students attending class because of a poor internet connection. What solutions do you propose to bring high-speed internet access to students?
Well, obviously, there has to be some kind of federal nexus, and working with the existing telecom companies. I'm not envisioning kind of like a regulatory regime, but there are ways that this can be done creatively. It is very, it's kind of an interesting problem. I once suggested to a local telecom company that they could put Wi-Fi on every bus very easily, and students could work on their homework on their way home. And at the time that I was suggesting that, someone said, well, they'll go online for other things. And well, they're going to go online for other things. Of course they are. But the opportunity is presented to them. So we have to think of Wi-Fi and access to Wi-Fi in the same way that we think of it as access to power and water and waste collection. It's just part of the utility of life in the 21st century. How we deal with that is made most urgent right now by the fact that the educational challenges are so high. And so we have to find a way to either fund that directly, and we can do that. I'm almost certain, I can't say with any sense of direct connection, but I'm almost certain that there's going to be subsidies extended for that purpose in legislation coming up next year in the new Congress, and that there will be opportunities for Guam to be included in that, and maybe even expanded in that, and maybe even Guam used as a model destination. It's really an indicator of how we see the future of the island and the future of our children. And we have to think about, of course, we're focused on jobs, and we're focused on keeping families together and giving them enough money to be able to survive the next few weeks and the next few months. But right now, students are losing basically months of education because of the current crisis. Some of it is technical, some of it is just the enormous challenge of it, and both students and teachers are not quite ready to engage in it. But, it's like trying to say, well, we want cool classrooms, but we don't have any power. And so it's looking at Wi-Fi as a utility, as just part of the necessity of 21st century life. I believe in that, and I believe that is going to be a major concern in the new Congress, especially since education has so dramatically pointed this out.
One follow-up question: Have you reached out and collaborated with the local telecoms? Have you reached out to them already?
Yes, yes. We've had conversations. Of course, they all have they're all in competition with each other, so they have sort of different views of it. And I'm not trying. And I want to use the competition to the advantage of students. I don't want to eliminate competition to the disadvantage of students. That's So of course I believe in the free enterprise system. So. That's important to note. When I say that it should be treated as a utility, it's not meant that we're going to have a kind of a regulated one company town in that. That's not what I'm talking about. I'm just saying that we have to see it as a utility. And some of these companies, if we give them the right incentives, they might think a little bit further out of the box on this. And I believe most of them have thought about it in a very serious way, and they have to think of it. And I think that how else are we going to protect the island community into the future unless we give our students an opportunity to learn online? We're all learning online. We're doing this press conference online. This is just the way business will be done for the foreseeable future. And it's certainly a good estimate that, even if we go back to so-called normal times, 25 to 30% of education will be done online, and that even in the classroom, students are online. So it's a feature of our life, and that's why I mention it as a utility. We should think of it as one of the essentials of life.
Thank you, Congressman.
Thank you.
Thank you, CJ. Does anyone else have a question for the Congressman?
Hi, I'm Annie from the PDN, and I do have a question.
Sure.
So this year, because of the pandemic, a lot of students have lost parts of their education in terms of quality. And as a congressman or as a delegate, how do you plan to mitigate that decrease in quality next year? And then how do you ensure that during regular years, there are already a lot of lack of teacher staffs or substitutes coming in, even before COVID? How do you plan to mitigate and reduce that?
Well, of course, I'm running to be the delegate, not the superintendent of schools, but the issue is really training. It's training for the educational staff, and it's training for school aides, it's training for teacher aides, it's training for everybody. And we've already lost, I think I said earlier, I think we've lost several months of quality education. In education, there's a common thread of thinking that says, students are, when they so-called summer vacation, they lose 2 or 3 months and they lose 10 to 20% of what they learn, and you have to kind of remake it up in the following school year. Now we're talking about 50 to 60%, and the fact of the lack of participation rates. So, from the federal level, there might be incentives given to school systems to go to year-round schooling next year. Real incentives. The notion that, look, we've had our time off, now we're going to go year-round schooling, and we're going to be engaged in this because it's a difficult thing to make up, but we have to make it up. And that's why I think the treatment of Wi-Fi and internet service as a utility is so critical. But there's retraining, there's incentives, there's cross-training for educational personnel. And, I don't know that any school system has responded as intelligently to this as they could. Maybe some charter schools are doing it better than others, and maybe some private schools are. So we're going to, my thinking and my representation would be towards including all of those in some kind of common conversation. I don't want to say I'm going to be the education delegate, but it is a big part of my professional preparation.
Thank you.
Thank you. So, anybody else have a question for the congressman?
Former congressman.
Do we have to say it that way?
No, you don't have to say. I just want to make sure that the participants don't think we're.
That you are? Okay.
Yeah. Well, any other questions on any other topics? I'm happy to answer any questions as well.
Okay, I think that's it.
All right. Well, let me end with this then. I frequently, as a longtime teacher, when I ask the class if you have any questions and nobody says anything, sometimes I say, okay, do you have any answers? And so that's the common refrain. But I want to stress again that we're doing this in order to demonstrate our commitment to ideas and principles. We're laying out a platform. Sometimes we say, oh, what are your ideas? Well, here they are. And we did it with the economy and pandemic relief. We're doing it with education and healthcare. Next week, we're going to do it with some constituency issues pertaining to veterans and Manomco, senior citizens, and the Manobin, and young people, to try to explain how we envision what a federal partnership will look like in dealing with these constituencies, which are so critical and important to the island, and we think that are not being attended to sufficiently. And then we'll conclude with some major policy issues, including EITC and Compact Impact Aid. So I just wanted a chance to preview that. Thank you very much for your attention, and thank you for joining us this afternoon.
Great, thank you, everyone. I'll be sending you a news release after this. So thank you, Robert. Everyone, have a nice day.
Yep. All right.